Hello, this is Dr. Gay from First Look MRI, and I'd like to show you an MRI of a torn Peroneus Brevis tendon. So I'm going to start with the side view here, where we can see the ankle from the side. This is the heel and back. This is the talus, and this is the tibia here. If we look in the very back here, we see the Achilles tendon coming down and attaching to the posterior calcaneus. Looks great. If we roll off towards the medial side, we see the medial tendons are intact. We see the posterior tibial tendon here coming down, attaching. We see the flexor digitorum tendon coming down next to that. And then the very back over here, the flexor hallucis looping around and coming down. Now we're going to go off to the lateral side, and here's where we have the abnormality. On the lateral side, there's two tendons, and the one in back, the peroneus longus tendon, is intact. There's a little bit of gray signal, so some mild tendinopathy, but not torn. But the Peroneus Brevis tendon that is in front of it usually is a smaller tendon, and this one is torn. There's a longitudinal split tear. And these tears are best seen on axial images. So if I put up an axial image, now on the axial image, the front is here. This is the back over here. This is the inner side, and here's the outer side. And so we're going to look for these Peroneus tendons. So the Peroneus tendons, you have a brevis in front and the longus in back. And here we go. This is the longus. It's intact, nice round, dark tendon. And this is the brevis in front that looks really gray and poorly defined. So we're going to roll up to the top above the ankle joint. This is what they call the supramalleolar, the upper part. And here we see these two together. This is a muscle blending into the central tendon of the Peroneus brevis. There's a little curve there, which can be normal up high. But if we come down, it never turns into a nice round tendon. It stays deformed. And then right here we see that there's a split component. There's a front component and back component. So a longitudinal split tear beginning about the level of the fibula. Here's the fibula. So this is what they call a juxtamalleolar and inframalleolar tear. It goes down below. And if we keep on going down, it gets really poorly defined here. And then it starts to zip back together. Here down pretty low, we see that there's a component here and a component here, and they start to zip back together. And now we have one tendon again. It's a little bit thickened almost all the way to the attachment, but a longitudinal tear, we can see the exact same thing on another view here. This is a T2 weighted image, so fluid is bright. So if we roll up again to the portion above the supramalleolar, we see the muscles and tendons okay. If we come on down, we see the Peroneus longus and back looking good, but in the front we start to see that longitudinal tear. I'll start above it. There we go, the front and back component. Lots of granulation tissue or scarring at the site of tear here, and then if we come down further, we see the two components, and then it zips back together there. So thank you very much.